Diabetes is a common condition affecting people of all ages. Type 2 is the most common. A combination of treatments can help you manage it and live a healthy life.
Diabetes is a condition that happens when your blood sugar, or glucose, is too high.
Diabetes develops when your pancreas doesn't make enough insulin, or when your body isn't responding to insulin properly.
Diabetes affects people of all ages. Most forms are chronic but manageable with medications and lifestyle changes.
Glucose comes from carbohydrates in your food. It's your body's main source of energy. It travels through your blood to your cells. When glucose is in your bloodstream, it needs help, a key to reach its final destination. This key is insulin. If your pancreas isn't making enough insulin or your body isn't using it properly, glucose builds up in your bloodstream, causing high blood sugar. Over time, having consistently high blood glucose can cause health problems, such as heart disease, nerve damage, and eye issues. The technical name for diabetes is diabetes mellitus. Another condition shares the term diabetes insipidus, but they're distinct. What are the types of diabetes? There are several types. The most common forms include type 1, type 2, and gestational diabetes. Common forms include type 2 diabetes, prediabetes, type 1 diabetes, and gestational diabetes. Other types of diabetes include type 3C diabetes, LADA, MODY, neonatal diabetes, and brittle diabetes. Hit play to dive into the world of type 1 diabetes. You'll get the lowdown on what happens in the body, symptoms, management, and more. Type 1 diabetes is a chronic autoimmune disease where the pancreas stops making insulin, requiring daily insulin injections and glucose checks. It can strike both kids and adults, and it's lifelong.
High blood sugar causes hyperglycemia. This can lead to serious health problems or even death if it's not treated.
Type 1 diabetes symptoms include excessive
Pee again.
and peeing frequently. Symptom 1, extreme hunger. Symptom 2, unexplained weight loss. Symptom 4, blurred vision. Symptoms usually start mild and get worse over days, weeks, or months. Fruity smelling breath, nausea and vomiting, abdominal pain. Confusion and extreme tiredness. Scientists don't know the exact cause of type 1 diabetes. It happens when your immune system mistakenly attacks the insulin. Certain factors, like a virus or environmental toxins, may trigger your immune system's attack if you have a genetic predisposition for T1D. Complications of this condition. Over time, continuous high blood sugar can damage many parts of your body. Potential complications of type 1 diabetes include eye problems, foot problems, and heart disease. High blood pressure, kidney disease, oral health problems, neuropathy, skin conditions like dry skin, bacterial and fungal infections, and diabetes-related dermopathy, stroke. If you reach the first 20 years after diagnosis without any complications, your prognosis is usually good. People with diabetes are also 2 to 3 times more likely to have depression and are 20% more likely to be diagnosed with anxiety than those without diabetes. The main components of management include insulin therapy, glucose monitoring, education.
You've got basal insulin for background coverage and mealtime insulin to tackle carb-heavy meals, plus correction doses to bring down high. It's like a delicate balance sugar act, but once you get the hang of it,
You can take insulin in the following ways. Multiple daily injections are pre-filled with insulin. Insulin pumps deliver insulin continuously. The amount of insulin you need from day to day will vary across your lifespan and under specific circumstances. Too much insulin can lead to low blood sugar. This needs treatment right away, often with sugar. Is there a cure for type 1 diabetes? Scientists are closer to an oral insulin pill. A DNP peptide helps it survive digestion and enter the bloodstream. In mice, it improved absorption and controlled blood sugar effectively. If successful in human trials, this breakthrough could replace daily injections and transform diabetes care for millions worldwide. 2 types of transplants may cure type 1 diabetes, but they come with significant risks, like surgery complications. Providers only approve them for a small number of people with type 1 diabetes. The transplants include: the FDA has approved a new treatment for people with difficult-to-manage type 1 diabetes, pancreatic islet cell transplantation, and the transplant may completely eliminate or significantly reduce the need for injections. You may qualify for a pancreas transplant if you also need a kidney transplant. The procedure involves placing a new pancreas during the kidney surgery. That sounds amazing! What can I expect if I have this condition? With type 1 diabetes, you must make countless decisions every day to stay healthy. It's a complex condition that requires a lot of effort and planning. This can be tough, but it's also very doable with the right diabetes technology, education, and healthcare providers by your side.